Hello everyone. First of all, I wanted to apologize. Hello everyone. First of all, I wanted to apologize for the delay in the results since the weekend. It's just simply due to the sheer numbers of the results and the need for us to collate them all and to make sure that we're not presenting any duplicate results. I'm sure you can understand that when somebody comes for an initial test, that's fairly straightforward. We can count that as a positive. But when they come for repeat checks, they will still appear in the list of positives, and it takes quite a bit of time to go through and check that we're only reporting one person for a single occasion at that time. So as we know, on Friday, the total number of positive cases that we've had since March last year were 1,804. On Monday, the 1st of November, that total has risen to 2,241. This represents 418 new community cases, but this is over a 3-day period, and that represents an average of around 139 people a day. There are also 19 people who were tested positive when they had their test to exit quarantine, and they obviously remain in isolation. These positives are on a background of having done 3,693 PCR tests since Friday until Monday. And just to give you some idea of the magnitude of these PCR tests, since the 8th of September, with our first community outbreak this year, we've done 44,248 tests in all. There are now 1,205 active cases overall throughout all of the islands, and in addition to this, there are 70 active cases in the sister islands. I'm very happy to report that of these, 44 are symptomatic and being managed at home, and 26 are asymptomatic. Of those 70 cases, 68 of them are on Cayman Brac and 2 are on Little Cayman. There were no vaccination clinics on Monday, so I can report the vaccinations as of the end of last week on Saturday, and this is a total of 115,481. For those people having first doses, this has now reached 80% of our estimated population of 71,106, and the number of people, absolute number of people, is 56,661. For those who've had completed the 2-dose course, this is 54,468 people, which is now 77% of our estimated population, and 4,352 people have had a third or booster dose, and this represents 23% of those over the age of 50. As far as admissions are concerned, we have had a few admissions since last week, and there are now 8 people in total admitted at the Georgetown Hospital, but I am pleased to report that only one of these needs supplemental oxygen. That means having a little bit of extra oxygen other than room air. So that is good news. Additionally, I need to say that on the whole, at the Georgetown Hospital, we often admit people and give them the benefit of the doubt in order to make sure that we can watch them and monitor them. And I think perhaps in even up to half of the cases that are currently admitted, in many countries, these people may well have been managed at home, but we have erred on the side of caution to keep them safe and comfortable and under observation in the hospital. Thank you.
Good night, everyone. You're watching the CMR COVID Spotlight. I'm your host, Kevin Watler, and Sandra is in the background. She's going to be monitoring your comments. If you have any questions for our experts tonight, please do write it in the chat, and we will definitely ask them your questions. But in the meantime, as you are watching and you are on your phones, please do share that you are watching this show. We want everyone to be able to get this very important information. And we have public health experts from the Florida Department of Health in Hillsborough County, Ryan Pedigo. He is the Preparedness Director. And we also have Angela Baird, who is our planner at the Florida Department of Health in Hillsborough County. Welcome. That's my boss and my big sister. Welcome, you all.
Hey, Kevin. It's good to be here.
Hey, Kevin. Thank you for having us.
So just for everyone's knowledge, I call boss, and I call Angela big sister. We are one big family at the Florida Department of Health, and we're in the Public Health Preparedness Division. And so I wanted to make sure that everyone is getting some of the tips that everyone really needs to know. We went through our Delta surge and other COVID surges throughout the pandemic. And so we just wanted to bring the expertise from our preparedness team to everyone. As cases start to rise in the Cayman Islands, you heard Dr. Lee just now share that we have a lot of community spread, a lot of cases that are now occurring. And so we want to make sure that everyone knows what to do once, you get impacted by COVID, because ultimately we all going to be impacted in some way or another. So I'm going to start off with you, Ryan. Please, can you share with our viewers tonight, which we have well over 100 people actually watching right now, and that's increasing. So that's great news. But Ryan, can you please share a little bit about your background and how you got into the role you're in now?
Okay. I actually just pretty much stumbled into public health back in the 90s. I was on active duty military for about 25 years and thought I needed a change at about the 19-year point in my career. So I retrained into a medical field. And in the military in the US is they combine public health with the hospital folks. And so that was really my first exposure. And when I retired, I just happened to retire at exactly the right time when there was a position open and I was running healthcare clinics. And I've always loved sheltering and response and, deployments and that type of thing. So right after 9/11, there was a big push in the public health community with what happened to the responders in New York. As well as the anthrax response down in South Florida about that same time. So a bunch of positions opened up and saw my opportunity. I grabbed it and I've been doing this ever since. So what we do in the county for the residents is any type of disaster, whether it's a natural disaster like a hurricane or an infectious disease like COVID, we actually coordinate the response.
Hey, Kevin, you're on mute.
Oh, I sure am. And I was going to just ask for you, Angela, if you could share a little bit about your background.
Sure. Hi, everybody. My name is Angela Baird. And as Kevin said, I work for Ryan and with Kevin. We're all one big happy family. We actually have a few more team members with us, or not here with us tonight, but on our team. I actually began my career in the clinical world. I started working in a pediatric ER and ICU. I'm not a doctor or a nurse, but I did supply support staffing in a unit secretary and ER tech role. Meanwhile, I was going to school for psychology and forensics, so very far away from the public health field, which I actually tripped and fell into back in 2009. I went to work at the Crisis Center of Tampa Bay, which was a mental health role. I was a supervisor, kind of supervising a call center as well as supporting the rape crisis center for the victims there. And at that time, there was a position that opened up called the MRC coordinator, which was a medical reserve corps group, which is medical volunteer response, and kind of felt that I would be good for that role. That was when I first was introduced to Ryan and Dr. Karuba, who was the mass casualty director at that time. So I stayed in that role and moved to Tampa Fire Rescue, and then ultimately ended up at the Department of Health with Ryan. As Ryan has said, we've been involved in numerous responses. I've helped with plans and responses for Haiti relief, 2 Super Bowls, RNC, infectious disease planning to include Ebola and COVID, and as well as Zika and hepatitis A. So that's how I got into it.
Well, really appreciate you all taking the time tonight to, spend with the Cayman Islands and share some of the experiences and to share some knowledge that we're going to get into it. So let's go ahead with the first question for the night. And Ryan, I'll start with you on the business side of things. How should businesses start preparing for cases?
Well, there's not really a lot of difference between how businesses prepare for their employees or their customers. It's a lot of common sense things that would occur. Doesn't cost a lot of money to do a lot of very positive things. The important thing to understand is you will not have no cases. If you follow my advice, you will have cases. Hopefully, you will have very few cases because the whole intent is to minimize the risk. It is a pandemic. It is coming. There is a very high number, or high percentage rather, of people who are asymptomatic. They're not ill when you're looking at them or speaking with them. They feel fine, but they're actually carrying the virus. They're the ones spreading it to others. So what you've really got to do is look at it. What is I as a business, whether I'm a restaurant, there's a couple of things I can do. If I'm a grocery store, there's a few other things I can do. As a shop, there's different things I can do. What can you do to minimize that close contact with other people? Obviously, the very first thing you want to do, and I was really happy to hear your rates on the vaccine, get vaccinated. That's the first thing. You're not, possibly people will still get COVID, even though they've been vaccinated, but the severity of the disease will be much, much less severe than if you weren't vaccinated. Very few hospitalizations. It's generally only people who have underlying health conditions that have a more severe disease after they've been vaccinated. But if they weren't vaccinated, it would be really bad for them. So vaccination, all the employees, everybody, that's a standard recommendation anywhere in the world right now. Get vaccinated. Some of the things you can do with your own staff is have them tested on a routine basis. We would recommend weekly. If that's not possible, I understand testing supplies are not always available, but just doing health screenings on them, educating those employees on staying home and not coming to work if they feel just slightly off. Call in sick, but as an employer, being supportive of doing that. One of the things we've seen here in our county, as well as throughout the state, people come in with runny noses and coughing going, yeah, it's allergies. I always have allergies. When it's really COVID, the symptoms are very flu-like, cold-like type symptoms, and you just don't know. Some people don't get the runny nose and the cough. They may just be totally lethargic. There's a few telltale symptoms where you've got COVID. If like you lose sense of taste and smell suddenly, you've got COVID, no question. But generally speaking, educating those employees to stay home, minimizing that contact. Don't let them come back to work, because by the time they're ill, they've already been transmitting the disease for 2 days. That's a lot of things people don't understand. Well, I feel fine. I can't be giving the disease away, but yes, you are. And it generally starts, you have enough virus in your body to start shedding it, what we call shedding it, or putting it out when you're coughing, breathing, wiping your mouth, touching doorknob, whatever the case may be. That's going to occur 2 days before. So getting people to stay home when they're sick, wearing of a mask. Most people think wearing a mask is protecting themselves. The surgical mask, the cloth mask that you see around that people are wearing, that's more designed to keep you, the wearer, from coughing viruses out in your breath to other people. It will offer you some level of protection, probably minimal, but it's more designed for you to not give it to someone else. That's why we want everyone wearing a mask. And if everyone's wearing a mask, they're not going to be giving it to each other. So those types of things, if your employees are also protected and they're following the rules, that's actually going to help protect your customers. You know, it just goes without saying, if everyone's doing that, then you will actually reduce transmission. Keeping distances, like in a restaurant or a bar, you know, if I'm a bar owner, I'm probably not going to allow a bunch of people to sit up at a bar and start toasting and having a good old time and bring in the new year or whatever in a big crowd. I'm going to limit the number of people in there. I'd like to have my tables spread apart, 5 to 6 feet apart, to maintain that social distancing. If I've got booths, a lot of our restaurants here in this area, they've started erecting plexiglass barriers at the back of each booth from, you know, the two seating areas. Right in the middle, they'll stick a plexiglass barrier up about 4 feet. That actually helps reduce, because it's an airborne disease. So when you're breathing, talking, screaming, singing, you know, you're pushing that out. That plexiglass barrier will help stop it. So that's another thing. Outdoor eating and dining is probably the best way to go. The risk of transmission outdoors versus indoors is significantly reduced. In stuff like shops and grocery stores where you may have aisles, putting little arrows down with tape on the floor to get everybody to start going the same path and kind of serpentine or snake their way through, but everyone going into that same direction is going to keep people from crossing into each other and getting that close contact. So those are some of the things that a lot of people can do very easily. It's not very expensive. There's not a lot of capital outlay to, you know, redo it. You can go to the extreme and have your entire air conditioning system and air handlers redone, but that's very expensive. We like the more reasonable accommodations to try to get people to actually follow them, because that will help reduce risk. Does that kind of answer the question, Kevin?
It sure does. And we'll get some more into some of that examples of different types of businesses as we go along. But before we move on to Angela, if you look at the bottom of your screen, if you want to ask your question, I know some of you might be shy, but for those who might not be as shy, please go ahead and type in that URL into the browser, and then you can just ask your questions directly to our experts on tonight. But I'll go on to Angela now and just talk about families a little bit. In Cayman, there are a lot of multi-generational families. Sometimes you got an aunt, an uncle, or a grandparent that lives inside the home, as well as, you know, other members of the family. And let's say one of them tests positive, which certainly is occurring right now. What are some of the tips you would offer them on how they could live in the same house with a positive person?
So obviously the focus is going to be, we're going to isolate the sick and quarantine the well. I know sometimes that's very hard to do given the size of the home. Not everybody has multiple bathrooms. Not everybody has enough bedrooms where everybody can sleep individually. But for that individual who is sick, or that person who did test positive, whether they're asymptomatic, symptomatic, finding a safe place for them to be able to isolate away from the other individuals in the home that are well. I know in our particular circumstance, our oldest son tested positive after we had almost made it through, even like with the vaccines being on board. We ended up, he was one of our exposure points. He was going to college. He was hanging out with some friends, came back positive after they had tested negative. And, you know, we ended up just kind of strategizing ahead of time, even before anybody got sick, identifying what bedroom we would use, what bathroom would be used for the sick person, and then what would be used for those individuals that were well. We sectioned everything off so that he could safely isolate in his room, use his own bathroom. If there was a circumstance where we weren't able to have 2 different bathrooms, we had a plan in place for routine cleaning. Everything would get wiped down. And then we did wear masks inside the house to prevent any additional exposure. I know it can seem overwhelming. I think really, it's the shell shock. We're dealing with a pandemic and now it's infiltrated our home. And then when we are dealing with multi-generational families, we want to make sure that mom, grandma, grandpa, and dad are kept safe, especially if they do have any previous medical conditions that could potentially have a poor outcome. So having those strategies in place, really kind of looking at your home and identifying, it's almost like another version of hurricane planning, but more pandemic planning, infectious disease planning in your home. How can we minimize our risk and exposure, but still keep our loved ones safe and still be able to keep eyes on them in case they do have a medical emergency?
And home kits, you talk about hurricane preparedness, and we know we all have hurricane kits that we have as we prepare for hurricanes. What should be in the home kit? And I'll ask both of you that question. Start off, ladies first, with Angela, and then move into Ryan.
So that really is a great question, because I know from our perspective, I live in a house of boys, right? So my husband, my 20-year-old son, and a 7-year-old boy, and boys can be messy. But from a planning perspective, I've been doing this for years. We were always ready for a hurricane or a storm or a power outage or any type of hazard that we thought may come our way. But the one thing that I never included in our plan was an infectious disease. I mean, even with flu, okay, fine, somebody's got flu, no big deal. But then the pandemic came along. So it really forced me to look at what supplies we already had in place. I already had a bunch of cleaning supplies because I always stock up on that kind of stuff. And you don't have to spend a lot of money. I think a lot of people get overwhelmed with, oh, I need to build a kit. But that kit's going to be expensive because I have to put in bleach, I have to put in wipes, I have to do this, and I have to do that. And you really don't. You just have to build it over time. So I know I always had disinfecting wipes. We always had hand sanitizer available in the car. I prefer hand washing when you have access to soap and water. And my 7-year-old has been trained to wash his hands if he has access to soap and water, but sometimes you don't. So we had disinfecting wipes in our cars. We had a little basically COVID kit in our car where we had extra masks just in case somebody forgot a mask, hand sanitizer, the wipes, the works. But I know from a personal perspective, we only had one person going out and doing the shopping. Inside the home, we increased the cleaning measures inside the home, making sure that frequently touched areas like kitchens and bathrooms were clean, including the sanitizing spray.
And Ryan, you have anything else you want to add to that?
Yeah, I would like to add that, as your doctor had indicated at the beginning of the show, a lot of these people didn't require hospitalization, but they were in fact ill and they were probably experiencing symptoms. So having some over-the-counter medications available, just like you would for the flu, it's the exact same things you would take for the flu, you would be taking for COVID to help minimize any kind of symptom that's coming up, whether it's fever reducing medications, headache, congestion, your general over-the-counter meds that you normally have in your home now, or hopefully have, that this is what you would have for your kit as well. And don't forget the Pepto-Bismol.
Yes, definitely need that in the toilet paper. So let's go back to businesses now, for a positive case that's identified in a business. Again, let's walk us through a little bit, Ryan, and Angela, if you want to chime in on how employers should treat their employees, because we know employers at the end of the day want to make money. At the same time, they also have an obligation to protect their employees and their health. What are some of the things businesses need to keep in mind and probably be a little flexible with?
Well, as I said to start this out, one of the biggest things is going to be making sure that the employer keeps that employee at home and away from other employees as well as the customers. So you're not only protecting the other employees, you're also protecting your customer base. But if someone is ill, please be flexible to give them the ample time to go home. If they're symptomatic and you don't know, get them tested. That way you will know with a great deal of certainty whether they have COVID or it's just a summer cold. But one of the things is when someone has been identified, that let's say I have an employee, I work at the bar, and it was the same one that Angela's son came to when he got COVID. I'm going to be looking at who else was working and how close were they working together. And I'm going to actually notify every single employee, this happened. We have one of us is sick, positive with COVID, and you guys need to monitor. And then after 3 to 5 days, I want you to be tested, because it may take that long before the virus builds enough in your system to be detectable. You're not going to get exposed, last night when I was out, and then in the morning take a test, and it'll probably come back negative because the virus hasn't been able to reproduce in your system yet. So the first thing to do is that what we call the contact tracing within the workplace. You're probably not going to be able to notify all the customers. You don't know who was in the restaurant or the bar at that time. If you do, notify them. Hey, one of my employees was positive. You may want to wait a day and then go get tested. But definitely get the employee tested and then identify who they exposed. And as Angela was talking about in the home, cleaning is very important. And I don't mean, I'm not going to have to worry about cleaning until I have a case, but that continuous cleaning, even during the business hours, wiping things down is critical.
Yes, absolutely. And I just want to add to that. I feel even now, we're still dealing with the pandemic now, and our tolerance level has grown. So a lot of people, as well as businesses, have left their guard down, and to include where someone could be mildly symptomatic, saying, okay, well, those aren't the symptoms of COVID. You can go ahead and come in, because like Kevin said, we need to maintain our operations. We need to maintain our business. We need to keep money coming in. We need to keep goods going out. So it's really being mindful of your surroundings, and, even recognizing people with mild symptoms. This may be something that we need to put the pause button on, get tested, do the right thing, the responsible thing to keep people safe. And then my husband works for a very large grocery chain, and his store, they still have their cleaning measures in place, and they have a great notification system if someone tests positive in any of the departments. An email goes out to everyone who worked in those days to be monitoring their symptoms, and they go into what I would call a terminal clean. It's something that we use in the medical field, where basically they just go in and sanitize everything. So if you don't have a communication chain set up within your business or in the place that you work, it may be something that you want to consider.
So, we're getting ready to approach the holiday season, and that means a lot of gatherings, a lot of parties. And that we're going to take this discussion in two ways. First, let's start off with, maybe having a Christmas party or a work activity party in the workplace. Should that be occurring right now? And what are some of your recommendations? And I'll start off with you, Ryan, and then Angela, if you want to pick up, go right ahead.
Yeah. A lot of it depends on the current state you're in at the time from a disease perspective. If you have widespread community transmission, I would not recommend having a holiday party and bringing everyone in. If you have a very low rate of transmission, it's controlled. You're not seeing 100 people a day. You might only be seeing 5 or 10 a day. That means it's very localized transmission. The Department of Health there is probably dealing more of an outbreak type of setting where it's coming from very specific locations. It's not just everywhere on the island. So in that situation, until it's totally under control, gatherings outdoors. But again, wearing the masks, hand washing is critical. Gatherings outdoors are fine. We had a Super Bowl here in this past February, right at the tail end of our second highest peak. And there were only 53 cases out of 22,000 that were identified, but none of those cases were or the person who was COVID positive did not get the virus from the game based on when they were exposed to when they were diagnosed. They had to get that virus prior to the game. So it's an outdoor stadium. They maintain distancing. We worked with them on all the interior stuff as well as all of their planning. So you can minimize risk by doing things outside, out of doors, under cover, whatever, but having that breeze blowing. And because remember, this is an airborne virus. It's you're likely to more catch it from someone breathing on you, coughing on you, than you are grabbing a doorknob. Although that's possible, that's why they recommend the cleaning. But airborne does not do real well outside. Inside, it will linger and float for several minutes. So someone coughing, and a minute later, they're gone. You walk through where they have been breathing or coughing, that virus is still going to be in the air and you're walking into it. So I would recommend taking it outside. And if you're in a moderate transmission level, that would be fine too. But once you're substantial or high, I don't recommend having parties.
Angela, you want to pick up on anything else on that, or you think he got that answered pretty well?
He got it covered.
Perfect. Well, we do have some comments coming on in, so I'm going to bring Sandra on, and let's take a look at some of the questions and comments that are coming in on social media. Again, if you have any questions, please write them in the chat, or if you look at the bottom of your screen, you'll see a little URL. You'll have to put in that HTTPS : / in order to join the show. But if you want to ask your questions directly to our experts on tonight, please feel free to join our conversation. But Sandy, over to you.
Okay, thanks very much. Good evening to everyone who's joining the show. We've got Petracat, who says, what about beauty salons? People always have to be close together. So any recommendations specific to a beauty salon environment?
Go ahead, Angela.
Oh, yeah. So as Ryan said before, obviously any way to minimize risk is key. I still know beauty salons to this day that are maintaining distance. That's one thing that you're going to be looking for, if they can keep that distance where the clients and the employees are concerned. Frequent cleanings. Salons are very high touch points, and the exposure can be large. Especially if you are in an area of high transmission, as Ryan said. I know from a personal perspective, and with a mother that has a failing liver who does go and get her hair done, the salon has been very accommodating and making sure that she has a private area. The employee does wear a mask and she wears a mask at the same time. So, I mean, those you have to weigh your risks on that, because it is a very high exposure possibility for an individual to go and get their hair, their nails done. But it's not impossible to minimize it.
Yeah, and I would just like to add, like in a barbershop, and I mean, I know you can't see on the camera real well, but I don't go to the barbershop very often these days. But when I do go, and I have not gone since the start of our last wave, which is now pretty much done. So I'll probably due for a haircut the next week or two. But wearing a mask and insisting that the barber actually wears the mask. And we get a lot of people who wear a mask, and they kind of do it like this with their nose sticking out. That's not really doing me any good. So I'll actually point it out to them. But Angela brought up a really good point for those of you who may have some type of immunocompromised system or some other condition where it would be considered an underlying health condition and not real good that you get COVID, you can actually call the salon or the barbershop and have something pre-set up for you. And that's what I would recommend, because, life is going to go on, and I do need a haircut. So I'm going to, have to deal with it.
Absolutely. I think the biggest thing is communicating, because I know from my perspective, our hairstylist, we have a personal relationship with her, both my mother and I. So she knew what we were dealing with ahead of time. And my biggest reminder in this entire event, and if it's the one thing that everybody takes home, is be respectful and kind to one another. Respect people's boundaries. If they identify that they have a concern, if they identify that they have an issue, really listening to them and seeing what you can do for your client, for your employee, for your family member or your friend, even as we go into the holidays. There are ways that you can keep yourself safe and still get your hair done, get your nails done.
Yeah, one recommendation I would make, because unfortunately, I have to take my daughter because she's got very long hair that I can't quite manage, but I try to take her during non-peak hours. So, kind of after hours, like before the salon is closing, when there's really not that many other people in there. And of course, at the particular salon that I go to, I've questioned, is everyone vaccinated? And they've confirmed that their staff are vaccinated. And I know that earlier in the week, they actually tested and all came back with negative test results. So it's also good to know that people in salons are testing on a regular basis. All right. So we've got Andrea, who says this is the new norm. It's sad, but we have to try to live with it and take care. Jane is joining us. Good evening. Carol is here. Kara says all well and good. They're only doing 500 tests a day here at the moment. People aren't going to wait days at home, possibly unpaid, before they can get tested. The whole system has collapsed.
Yeah, I would like to make a comment to that. And believe me, I actually sympathize with that. We have a lot of business owners. I have a lot of friends who are small business owners who they can't afford to wait 2 to 3 days. But there are a lot of rapid tests out there that are available. You get your result in 15 minutes. You're not waiting 2 to 3 days for that lab test to get sent off, analyzed, and then finally get your results back.
Right. And we've just recently introduced lateral flow testing here. And I think a lot of people have been utilizing them, so much so that I think we've pretty much run out of them on island. So a lot of people are actually waiting for additional shipments to come in. So Jasara says she's loving tonight's show, very informative. Elmer says some employers have positive cases and tell them to get tested, but they can still work while they await their results. And he thinks that that's wrong. Yes.
I agree.
You're right, Elmer.
Yeah, very good. Magdalene is here, tagging a few friends. Good evening, Perla. And Michelle says, I think that other important items to have in the home are disposable cutlery, straws, plates, and lots of plastic bags, the supermarket size, for daily collection and proper disposal of food items from the sick person. Failing that, Milton sterilizing or good quality dish soap, for example, Dawn or dishwasher set to sterilize. Dish rags and sponges can be used in the washing machine and then, while still damp, microwaved for a few minutes. That way they're reusable and less of an issue. Just a quick question about microwaving dish rags, because I know some years ago there was a recommendation about microwaving your sponges that you use to wash dishes. And then they found that the process of microwaving it actually tended to spread bacteria more than kill the bacteria, which is initially what people were thinking. Would you recommend microwaving like dish rags or, well, obviously they said don't do the sponge. So I wonder if the same would apply to the dish rags as well.
Personally speaking, when we managed our exposure as well as the positive case in our own home, we did not. Everything was either disposable, and if I could not, if I could not sanitize it in the dishwasher or in the washing machine, it was thrown away.
Mm-hmm. All right. So Lavana is here. She says most salons are doing really well. I know for sure that my salon is very good with cleaning, etc., social distancing all around. Maybe I could throw a question in there, because I know that one super spreader location that we've had has been one of the local bars. Is there anything that bars can do? Because they're very, very high risk. And then I'd ask the same about churches. Is there anything specifically first to bars and then churches that they can do to try to minimize the risk to people in their establishment, to their customers and employees as well?
Yeah. And, the one thing I recall from probably 30 years ago, cruising around the Caribbean, was the beautiful weather, particularly in the evenings. So from a bar's perspective, if you can have an outdoor area that people can go to, that the patrons can go to and have a good time, that's ideal. Limiting the number of people that are at the bar, removing every other bar stool to where you're creating that distance, keeping the table separate. It's really hard for people who are out having a good time to say, after my fourth or fifth or sixth or 12th beer, I'm gonna social distance. That's not reality. We know they're gonna hang over each other. I mean, Kevin comes in the mornings. It's like, where have you been all night? It's just important for the owners and the workers of the bar to try to get the patrons to do it. We know that not everybody's going to listen, and there's going to be problems. But if you take away their opportunities, like removing some of the bar stools where you don't want them, next to each other, standing shoulder to shoulder, limiting the capacity, you're still staying open, you're still affording a service, and then potentially moving outside seems to me the best way to do it if the weather's nice and there's no rain. And we're getting into, in South Florida, we're getting into our beautiful time of year for being outdoors, but we had outdoor dining all summer and it was really nice. And I actually kind of miss it when I go out to eat, because they've taken all the tables and put them back inside.
And in reference to the church, part of the question, having some flexibility with the services, limiting capacity. I know it's really hard to do with church services because everybody's happy to see each other. Everybody's praising their Lord or their God, whoever they're there to worship. But also, having encouraging masks, those individuals who want to congregate together, encouraging that they be vaccinated. Still having a virtual option for those individuals who may not be ready to come to the church service. That way it does help kind of limit the capacity. I know a few churches here in this area, including the one that my mother goes to, still offers offers multiple virtual services and encourages individuals to stay separated, wear their mask. And they are actually one of the few churches that has not had an outbreak yet.
Yeah. And if I could add one more thing on the churches, choirs. When people are singing, they're pushing out air at twice the rate we are just talking. So they're actually spreading their air further than I am right now. So choir, and I've worked with a couple of specific churches here in the area to separate out the members of their choir and kind of keep them separated and back from the audience.
Very interesting. And of course, we know that gyms are high sort of infection spots as well for that same reason, because people are exercising and that propels the virus even further. If you're running on a treadmill, if you're lifting weights. So I guess similar recommendations for gyms as well. Trying to, limit the space, keep your social distancing,
keep
wear
them
masks.
spread out.
Yes, it might be difficult wearing a mask working out, but working out in outdoor spaces. So Perla, thank you so much for joining the conversation. Perla says, what about supermarkets that most go to and have no respect because there's no 6-foot distance stickers on the floor? Now, there used to be, but I think Perla is right. Maybe in some locations they've now disappeared. I know. Sorry, I was going to say during the height of the pandemic here, one of the things that Foster's grocery store did is they insisted that every single person entering the grocery store take a cart and not a handbasket, because the cart forced you to do a certain degree of social distancing.
That's a smart idea. We did not think of that.
Yeah.
Kevin, that's your fault.
Yes, it is. I'll take full responsibility.
That's a great idea. But tape is easy to put back down for people to maintain social distancing. It comes up very easy,
have to be
but it
fancy
also
stickers.
goes down.
Yeah.
Very easy.
We also have, our grocery store is obviously a lot smaller here, but again, speaking specifically to Foster Supermarket, they actually removed like the end caps on some of the aisles. I've noticed just when I went in this week, the open food, the hot food bar is now a lot wider. So there was something in the middle there. I don't even know what it was, but it's definitely a lot wider. So they've actually removed certain physical things that were in the grocery store. And then in other instances, they have actually put barriers that force you to go one direction as opposed to then passing people, So like in the produce section, they kind of made it one directional at one point as well.
Yeah, the extent that they can do the direction thing has been very, very effective. And also at the cashier, a little plexiglass barrier up in front of the cashier protects both the cashier as well as the customer. And they just money underneath it.
Yes. I think most retailers here now, even food service places, all have the plexiglass up. So that's a great idea.
That's good.
So Carol is lamenting that we can't get a hold of any lateral flow tests. They're selling out within hours. Yeah. Foster's had some today, she said, but sold out before mid-afternoon. Wow.
One of the things I want to comment on that too, where businesses can also maybe help out too, is you could sometimes even get a better price, or if a business goes in and purchases it for their employees, if they could source it and bring it in and also have it available for their employees, that's also a good idea, especially for bartenders and stuff. Before you work, got to take a lateral flow test to make sure that you're good to go.
Yep. Rachel says that we're having exponential growth here. We had a daily average of 14 a day in mid-October, 30 a day a week ago, and by the end of October, it was now 130 plus a day.
Yep.
So this is to be expected. Claudia says, good evening, all. It's good to be tuned in. I'm back in my island home, fully vaccinated, but still in quarantine and making the best of the current situation and observing what's currently happening with respect to the kind of got cut off there, Claudia, but thank you so much for tuning in. What advice would you say, because we've got some persons who know that they're positive, or they know that they have a household member who's positive and they still insist on going grocery shopping, going to work, going to the local bar. What advice would you give those people to perhaps, allow them to see the seriousness of their actions?
Angela, do you want to go first on that one?
So I'm going to speak from personal experience, and I think this is why Ryan asked me to go first. We had a very unique situation happened last Christmas. Our youngest son, who was 6 at the time, there was a large outbreak at the school, and he was exposed. His first grade teacher came back positive. He goes to a private school. So private school kind of functions under different rules and regulations. They did not have a mask mandate in place, although our son did wear a mask. So he came home. We did the quarantine for 14 days. And the end of quarantine was Christmas Day at 6 p.m. And half of the family insisted on still having their Christmas holiday dinner. My husband and I respectfully said, no, sorry, we're not going to come. We're not going to take the chance just in case. He and our son had never shown any symptoms or anything like that. But we just didn't want to take the chance. We had one grandma in liver failure and another grandma with multiple comorbidities to include obesity, diabetes, high blood pressure. We just didn't want to take the chance. So we missed out on the holiday with half of the family. They still chose to gather together. A couple days later, my husband and the youngest son go to drop off gifts. And when they dropped off gifts at one household, they were told an individual is sick. That individual did not come out from the bedroom. They went to the next household. Unfortunately, those individuals were symptomatic. They did not tell us they were symptomatic. And my husband and my son were exposed for a second time and had back-to-back quarantines. So when I get this question, whether it's an employee, a family member, or a friend, please do not take the chance. You may be well, that person may have minimal symptoms, but there is someone out there that this virus could permanently harm or kill. It's not worth it. It's not worth it. I understand it's a huge inconvenience, but if you can do a mobile grocery order, if you can have a neighbor help you, if you can have a friend help you, if you can reach out to your church congregation, post it on social media. Hey, I need some groceries. Can anybody help us today? Really exhaust all options. And I know Ryan and I took many calls, including Kevin took many calls over the last year and a half from individuals who literally did not have any resources or friends to be able to help them. And we were scraping the bottom of the barrel. Okay, how can we get them some food? How can we get them some masks? How can we get them what they need so that they don't have to go out into public? But I know sometimes a lot of people don't do that. People may be stubborn and people may not want to ask for help. But this is a time where we need to help our fellow man, help our neighbor. And that's why the biggest thing that you take away from this is be kind and be respectful of people's boundaries. If somebody needs help, the first thing that I find, if I get the call that somebody has COVID, the first thing I'm saying is, can I drop off food? Can I go get your groceries for you? Doing whatever I can, even if it's someone that I barely know. Any little thing that can keep those individuals in the house so that they can weather the storm for the 10, 14 days. That is my biggest encouragement of tonight.
And just for the benefit of our viewers, remember that there is support here in the Cayman Islands. If you're in isolation, there's an isolation support line that you can call. There's a toll-free number, there's a regular line number, and there is an email address, and then their operating hours. So again, as Angela said, rely on those government services, call somebody for help as opposed to going out and exposing other people. And it's not worth it. I mean, I heard a story about a lady who was on Saturday at the Field of Dreams watching a baseball game with children playing. I don't even understand the logic of that. That is certainly not an emergency situation. The following evening, she was at Zodiac Bar having a drink for Halloween on Sunday evening. And it's just that, people don't appear to be taking it seriously. Ryan, what are your thoughts? I think that the Cayman Islands, unfortunately, has lived in a bit of a bubble for so long that we don't seem to have a good idea of how devastating COVID could be. We've only had 2 deaths, and they were not really people in the local community. So there is that removal from reality when it comes to what COVID can do to any community.
Yeah, and I don't think it's so much in the Cayman. That's here in Florida. We've had over 2,500 deaths. It's individuals who are basically, I'm going to be brutally honest, I think people are being extremely selfish. They don't want to interrupt their time. They want this to go away. They want this to be over. Well, it's not going to be over. And if you keep going out and giving it to other people, it's just going to perpetuate and pass from one person to another. I spent the entire 4th of July weekend dealing with a firefighter it's been several months, but he passed away just a few weeks ago. He was around people and contracted from his coworkers who said, "We feel fine." It's not about you. It's about who you're going to give it to. You look at your neighbor, you don't know whether that individual has some kind of condition that getting COVID will kill them. You don't know that. It's like playing Russian roulette.
Yes. And that reminds me of a post that I actually have up on my personal Facebook page. It says, I hear a lot of people saying that I'd survived this virus. I'm taking my chances. And it says, yeah, you might survive it, but you also might carry it to someone who wouldn't. And that, folks, is the problem. All right. We've got a few more questions here from our audience. So Rachel is basically saying that people typically get that COVID floats in the air like a vapor or cigarette smoke. And so low ceilings and lack of ventilation and, people crowded together is a real problem. When she's thinking about schools and bars, just wiping down the surfaces isn't that helpful when the air is full of COVID. So surface cleaning versus cleaning the air, how would you compare the two?
Well, cleaning the air, there's several ways to do it. They make portable scrubbers. You can buy ultraviolet HEPA filters for your air handling system, which can be very expensive. A lot of it's going to depend on the size of the room you're in. And she is 100% correct. This is, as I said, it's an airborne virus. It's going to linger in the air for several minutes. Over time, it will settle down, and that's where the cleaning comes in, is once it settles down. But limiting access, keeping people separate, you're going to reduce the amount that's floating around in the air. But at the same time, you're still going to have to clean and do both. Ultraviolet lights on your air intake and the HEPA filter, they're very, very expensive. I know a lot of businesses cannot afford that. So taking other precautions to minimize the risk is the way to go for those folks.
Okay. Perla says, surprisingly, there's a few companies that have employees working from home. Should we all go back to alphabetical days, homeschooling and working at home, etc.? So, at some point during the initial lockdown, we had very restrictive movements. You could only go shopping on certain days based on your last name. That was to control the flow of individuals who were, in public spaces, including grocery stores. Homeschooling, obviously a lot of schools are trying to do online lessons, and where possible, some companies were allowing their employees to work from home.
Yeah, I mean, working from home, Kevin and Angela, y'all can cover your ears now. Working from home definitely is a benefit for the individual employee and minimizing their going out and about. But a lot of it's going to depend on how much disease do you have going on in the community right now. As I understand it, you have widespread community transmission. So this is the time to start really bringing back some of those social distancing things. If people can work from home, there's a lot of people in the U.S., they don't want to go back after they were working from home. So we've got a whole lot of job vacancies where people are not wanting to come back. But it is a good point, and minimizing, at school, there's different things they can do for separation. It depends a lot on the class size. Our governor has dictated that everybody goes back in person. It is what it is, but our schools, by taking their precautions and distancing, they're kind of at the same level they were last year when the pandemic first started, before we shut them down. They had a huge spike, though, at the start of school again. It was brutal for them.
All right. Carol is talking about the UK's approach, which I don't know that they're necessarily being applauded for their numbers, but she says in the UK, you don't have to quarantine if somebody in your household is positive, but they have easy and free access to lateral flow tests so that you can take one each day whilst going about your normal daily routine. But I think it's interesting, Ryan, that you mentioned earlier that by the time that you become symptomatic, and maybe by the time you're even shedding enough viral load to get a positive result, you've probably been infectious for a few days already.
Yeah, and that's why when they do the rapid testing, I know quite a few businesses had implemented their testing their employees every other day. But we had plenty of rapid tests available. You have to have that supply in order to do that. But once the supply chain catches up and they become plentiful again, then businesses can start putting people on a routine schedule. If you're not vaccinated, then we're going to test you once a week. That's what our county had been doing for the government employees as well as the city. So there's a lot of things that can be done when the testing is available. But in the meantime, you have to kind of revert to a screening. Have you been around anyone? Should you be in quarantine because you're exposed? Fever, how are you feeling? Those types of questions, taking their temperature to make sure that, they're not just coming into work when they have a fever, but running through that process and getting those things in place from some level of screening is going to help.
Okay. All right. Carol says she'd rather them close the bars first before adopting the name day shopping and working from home. And Elmer's enjoying the program. Says thanks, Kevin, for keeping up the good work. And Sandy, can't forget you, Big Mama. Thank you so much, Elmer. It's hard to believe that an hour has gone by already. Kevin, back to you.
Thank you so much, Sandy. And so just want to get to closing comments, but right before closing comments, travel season is really about to pick up. A lot of people are going to be traveling over the holiday seasons. Is this a time we should maybe stay home, or do you think traveling is going to be okay? I'll start with you, Angela, and then see what Ryan has to say as well.
I'm not traveling this year. I mean, as we said, we've already talked about ways that you can minimize your risk and your exposure. There are ways that you can try and keep yourself safe. When you go out to the grocery store, you go out to eat. If you have to travel, or if you choose to travel, there are ways to keep yourself safe, but just know that you're likely going to be exposed depending on where you're going. If you do choose to travel, I highly recommend that you check with your place of where you're going to end up to see if there are any testing requirements, quarantine requirements. Don't be caught off guard by that sort of deal. And if you haven't been vaccinated, I would go ahead and get vaccinated now. That way you've got, your vaccines on board before you go and expose yourself to a potentially dangerous situation.
Ryan, what about you? You got travel plans?
I can only say ditto to everything she said. It's if you're going to do it smartly. If you're going to travel smartly.
We do have one final question. Elmer says that Elmer works at a school equals my husband works at a supermarket. Is it necessary to wash your clothes every day?
Yes. Mm-hmm. Yes. My husband works for a supermarket, and he is just as anal retentive as I am. I mean, he was very OCD about his uniforms even prior to the pandemic. But as you know, grocery chains, like they are very clean. You have to be, otherwise you get in trouble if you're not clean. So he, at the very beginning, when we weren't sure about exposure points and what was going on, from a medical perspective, we were, putting our clothes in separate areas, things that we had been worn, because he grocery workers have high exposure rates. They're being exposed to multiple people come up to them all the time, asking them questions. They're dealing with vendors, they're dealing with other employees, team members, that kind of stuff. So yes, absolutely. Yep. Ours, they go in the hamper and then they are put in the wash.
Okay. Wonderful. Kevin?
All right. Yeah. Don't see anything else in the comments, even though we have well over 100 people still streaming and watching with us. Really appreciate everyone for, staying on and getting some of the valuable information. But let's move into closing comments. Angela, what do you have to say to end the show?
Well, first and foremost, thank you all so much for staying with us and asking those great questions and listening to what we have to say. As I'm just going to repeat what I said before, as we move into this holiday season, with schools and everything still being open, just be respectful, be safe, be mindful of things. Hopefully if you haven't thought of something that we've said tonight, we've got your gears turning and you can reevaluate your home for exposure points. You can strategize with your family if someone were to become positive or if we're exposed, how are we going to handle this? Reevaluate the holidays. How can you do virtual holidays or maybe, not travel as much? And then at the end of the day, if you have family members, friends, coworkers, employees that have opted out of certain holiday festivities, be respectful and be kind about their boundaries. They're still fearful and they're still trying to keep their families safe as well.
Thank you so much, Angela. And Ryan, what would you have to say to end the show tonight?
I guess just give everybody the bad news is that once the pandemic ends, COVID will not be going away. It is here to stay, and we will learn to live with it. And it will become what we term as endemic, meaning it's going to be just like the seasonal flu. We do have a vaccine available. People just need to take advantage of it, make an informed decision, not listen so much to what Angela and I or Kevin's talks about on here, but, go fact check us. There's a thing called the internet that you can actually do research on and verify what I've said or Kevin or Angela. We don't mind that. I'd rather people make very informed decisions because it's not about what you do to yourself. It's about what you're doing to everyone else, potentially. It just, I'd like to leave people to leave with, let me not believe everything I hear on the news or on a talk show, but actually go in and get ideas from us and then use the internet to do the research, read the studies.
And here's a good reminder of being careful of what sources you rely on. I had a physician send this to me, and he said, we have doctors and nurses who get their degrees from UE, that's University of the West Indies, whether it's Mona, Jamaica, Barbados, or Trinidad, the University of London, and the University of Cambridge. These are graduates that you can be proud of and who will give you information. Please do not listen to graduates of the University of Facebook, the University of WhatsApp, the University of YouTube, and the University of Instagram. These universities are not accredited anywhere in the world. So again, it comes back, folks, to the sources that you're using. Be mindful of, the source and where you're getting the information from. Not everyone might have intellectual capacity to go and read a study for themselves and fully understand it, but you can certainly speak to experts and they will try to break it down for you. But even not, it's incredibly interesting that not every expert can be trusted either. So be very, very mindful of just having a discerning spirit, I guess, at the end of the day. And just a little bit of breaking news for the people who have been watching this program. We were made aware during the program that one individual has been airlifted or medevaced from her sister islands, Cayman Brac, to Little Cayman, and because she was having some breathing difficulties, and she is a COVID positive individual. So as soon as we have more updates on that, we will let you guys know, but she is likely going to be person number 9 to now be hospitalized at the government facility.
Yep. And, everyone, I'm going to just again recommend, please consider getting vaccinated. If you have any questions, you know how to reach me. You could reach me on WhatsApp. You could reach me on social media. You can reach me through Sandy. Again, we're here to try to provide as much information we can to you so you could make those informed decisions. But again, I'm here because I love you. I want you to ultimately be protected. And so I want to really thank both Ryan and Angela for joining the show tonight, sharing some of the advice that was shared tonight. Thank you all so much for taking that time. I'll let you all go now, and I'll see you first thing in the morning.
Thank you. Good night.
Good day. When I spoke to you Friday, I updated you on a variety of issues, including that we still plan to reopen and do so safely on 20th November. I also reminded you that our plan to reopen is adaptable and that we will continue to evaluate situations and community transmissions that impact our country. Today, I continue to urge all of us to come together to ensure that we live our lives in the healthiest and safest ways possible to protect those among us who cannot be vaccinated at this time. And I continue to call for calm. To borrow a phrase from a motivational poster produced by the British government in 1939 in preparation for World War II, please keep calm and carry on. It is something that we as Caymanian people know how to do. We are resilient. We have demonstrated that as a people, we are very good at staring down difficulties, trials, and tribulations, and making life right again. Our forefathers did it in the many storms they faced, with the hurricane of 1932 foremost in our mind. Closer to our own time, we pulled together as a people and got through the ravages of Hurricane Ivan in 2004 on Grand Cayman and the devastation of Hurricane Paloma in 2008 on Cayman Brac. And while the 7.7 earthquake in January of last year left us rattled, it didn't shake our steadfast spirit. We are Cayman. We are one. We make it through adversity with the help of our brothers and sisters. It's what we do. It is what I'm asking all of us to do now. Don't let this COVID-19 pandemic pull you down. Yes, we have seen a surge in cases, but as I said Friday, that is to be expected. It is here. It is in our communities, and we, individually and collectively, have to do all that we can to help stop transmission of this virus. We know that this is manageable because our critical preparedness and response plans are working. While having positive cases in our families, our communities, and workplaces can be alarming, we have to appreciate the fact that we have not had any really critical illnesses from COVID. Yes, there have been hospitalizations, but our Health Services Authority is quite capable of taking care of all patients who enter their doors. I encourage you to remain strong, to pull together, to unite as one people. Continue to maintain the safety and hygiene practices that we are by now all familiar with. Keep on wearing your masks while out in public. Practice social distancing. Sanitize your work and personal space. And again, please, I implore you to really consider if that activity you want to do or the place that you desire to go is adhering to the best practices that will keep you safe. COVID is directly impacting our lives, but we are not helpless in this fight. We have ammunition through vaccinations and proper hygiene practices. If it is time for you to receive your booster, I encourage you to do so. If you still haven't had the vaccination and are able to take the jab, please get in line and roll up your sleeves. It is safe and it is in your interest to take it. I assured you last Friday that we are not headed for a lockdown situation, and those who spread false information that we are, don't have love for our country or our people. They are spreading false rumors and causing unnecessary, unwanted, and unwarranted stress and unease. So I ask you to keep calm and carry on. We are one team. We are one Cayman. And together, we will get through this.